2018 clip of Pfizer CEO Albert Bourla made the rounds on Twitter this weekend for his explanation on Pfizer's microchip technology to monitor patient compliance. Watch this.
It is basically a biological chip that it is in the tablet. And once you take the tablet and dissolves into your stomach, sends a signal that you took the tablet. So imagine the applications of that, compliance. The insurance companies to know that the medicines that patients should take, they do take them. It is fascinating what happens in this field.
Well, it wasn't long before the mainstream media put out some kind of fact check. USA Today notes, well, that was talking about a schizophrenia pill and accused vaccine skeptics of resurrecting the video, wrongly suggesting his comments were made more recently during COVID.
So we want to show you the actual question Bourla was asked before he gave his response, because it really had nothing to do with schizophrenia.
Other questions? See one right there?
Hi there, Human Hakami. I run the diabetes group for Medtronic. I have a question about patient engagement, and you had touched on this before. All of these advances are amazing, but even if you make the greatest drug or the greatest wearable, there's no guarantee that the patient is going to take the drug, wear the device. So how are you thinking about technology to engage the patient?
Yeah. Again, maybe I will use an example. I think it's fascinating what's happening in this field right now. I mean, FDA approved the first electronic pill, if I can call it like that.
And so that presumably the FDA approved the pill for a schizophrenia medication. So what they mean by compliance is, are you complying with the regimen? You know,
right.
Take 3 a day. You know, take one in the morning, take one at lunch, take one before bed. Are you complying with that? Because if you're not, then it doesn't work like it's intended to. So that's what they mean by compliance. However, deeply weird. Just from a human perspective, to start thinking you're going to ingest a chip.
I mean, the Steelman case here would be that, I mean, we do have a problem. Yes. Much of the homeless problem in a lot of cities is schizophrenic people who need antipsychotic medication, who, when they're on antipsychotic medication, are not public hazards, but will go for long stretches where they're not taking it. And it is currently, since the 70s, since the changes to how these laws work, it's hard to force people to take, the state really can't force people to take medication. But it would be better if they did take their medication. So you could see how this would have some kind of benefit there. All that said, what the public health establishment has shown us in the last 2 years is that they are desperate for more power over what humans are allowed to do. The immediate jump to requiring vaccination in a wide variety of circumstances, Biden snapping his fingers and saying, thousands and thousands and thousands of private workers should be required to get it, even if then there's scenarios where they don't really interact with very many of the other people. The push in some liberal enclaves to require kids to be vaccinated before coming back to school. College campuses are like, you have to be boosted 18 times before you can come back, among populations that are largely safe from the worst effects of COVID, unless you have some kind of immunocompromised condition. So that's a long way of saying the public health establishment has shown no ability to pull back and to go easier and allow more permissiveness when it's called for. They do seem to just gobble up more and more authority and power and more desire to control our lives. So I would worry that something like this, even if you can come up with a couple cases where it would actually be useful, right? Why? What's going to? They don't have anything. They don't have a limiting principle.
Right.
If Dr. Fauci, Dr. Walensky, they don't. Do they say, well, we could require this, but we're not going to? They don't really tend to say that. They say, yeah, it might reduce harms by even if it does a tiny fraction. Yeah, we should require it.
There are definitely people in the public health world who take into account public psychology and public attitudes around how you approach the public, trying not to push too far. Those people don't tend to be running Pfizer, for instance. But this is a case where you really can see an obvious benefit to something like this. In other words, you really would like to know if a schizophrenic patient has taken their medication. And it's hard for everybody to remember to take their medication, let alone people who are facing all sorts of mental health challenges on the way in. So you can see the benefit, because when somebody's off their meds,
Yeah.
That they can be a danger to themselves. They can be a danger to others. At the same time, especially as you're watching like this dystopian situation in Shanghai, for like we're aware of what societies can do to people in the name of public health, and so it's reasonable that people would see that video and be like, you want me to swallow a chip?
Yeah, absolutely. And then it gets to, well, who's actually crazy? Are we using it in a broad, just criminal behavior is you got to take your meds, or you got to be, put in under surveillance, or the kind of surveillance society.
Yeah.
What if I'm sure something insurance companies would like to do, right? They would like to.
Yeah.
You're taking your anti-smoking pills, or what are your heart disease pills, whatever that,
diabetes, everything.
Yeah, they want to know, for insurance purposes, make sure you're taking, and that gets into some really tricky privacy stuff. Already, I don't love, all of how many questions they ask you for what kind of coverage you're going to get, how at risk you are of certain things.
And the reporter was referencing wearables, which also insurance companies use.
What is that? I don't know.
So a wearable would be like a Fitbit.
Oh.
So it's like the insurance companies should be able to like monitor your heartbeat and see how much. If you're getting more exercise, they will have different programs in place that say, like, if you do these X healthy things to make yourself better, we will reward you. Just the same way that you pay more if you're smoking for your insurance. And so the wearables are a step in that direction, which but they can't tell if you've actually ingested the pill. So that's why the reporter was asking about that, and he went with, well, just follow the pill all the way into the belly then.
And the technology clearly is going to keep getting better. Like, we're not going to stop inventing things like this. Things like this are going to come along. We're going to have better analytics over the human body, over everything. That is just going to happen. So we need to enshrine norms or laws or whatever it takes to make sure we still, if we value privacy, if we value individual autonomy, if we value people's rights to have privacy about their medical decisions, that not everything is put to what government health officials want it to be, if we agree that that should be the case, then we need to lay some ground rules, because this kind of stuff is just going to get more prevalent. It's just going to get more part of what's out there, what's possible.
And meanwhile, as consumers, we want this technology to get better. On Friday, I left my AirPods at the pool, but the battery was still on. I went back yesterday, and it's telling me it's right there in the middle of the pool.
That is useful.
Except I couldn't find it anywhere.
You missed my saga. I'm sorry to have to repeat this story for our viewers. It was, I think, 3 or 4 weekends ago. I was flying out of Dulles, and I left my backpack in airport security. Got to my gate. I realized I didn't have it. I booked a later flight at the gate because the flight was leaving then. I went back to airport security to get it. TSA had already taken it away. And
had blown it up.
It had my laptop, my Nintendo Switch, a fancy pair of sunglasses, and then I realized, because they said they couldn't give it back to me. They said it's in a locked room. If they even had it. I didn't know they had it for sure. I'm like, screw it, I'm going home. Realized I had driven to the airport. My car keys were in the backpack. So I went on this trip anyway. I didn't get it till I came back. But the reason I brought this up is while I was on the plane, I realized I have that app on your phone that tells you where your laptop is. Mm-hmm. So I was able to verify that, yes, it was sitting in this locked room that the TSA did not have access to. I gather that the police, rather than the TSA, took it, and maybe they don't trust the TSA or something. It's in a room that the TSA doesn't have access to.
Did you get it back?
I did get it back after I came back from this trip, and I swear I will never do that again. Actually, I will never have to describe my backpack to a police officer. Be like, it's just a black backpack. They're like, what's distinctive about it? Nothing. It's just a black backpack. So I went out and bought a Charmander keychain to put on the backpack. So now it's distinctive. My
dad was once playing golf with a guy who got so angry he threw his clubs in the lake and stormed off the course. Sees him come back like 20 minutes later, fish the clubs out, get his keys out, and throw the clubs back in, and head back out. Didn't need to find me. He knew exactly where the clubs were because he had put them there.
That's how it goes.
Anyway, Team Rising joins us next. Stick around for that.